Hello and welcome to North Country Matters. My name is Donna Seymour. I'm the host of this program and a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. Today's guest is Meghan Conklin. Meghan is the Community Engagement Manager for Planned Parenthood of the North Country, New York, Incorporated. We're going to be talking about the wide array of healthcare services and education opportunities that her organization offers in their 7 health centers throughout the North Country, which include Clinton, Essex, Franklin, St. Lawrence, Lewis, and Jefferson counties. Meghan, welcome to North Country Matters.
Thank you so much for having me.
Well, you're very welcome. Let's start out a little bit by you telling us about yourself and what it is that you do for Planned Parenthood.
Absolutely. So a little bit about myself. I am a North Country native. I graduated from SUNY Potsdam in 2021. I majored in community health there, and I've been at Planned Parenthood pretty much ever since graduating. As for my work here at Planned Parenthood as the Community Engagement Manager, I oversee our community engagement team, which is responsible for education and outreach across our affiliate.
Okay, so that's a great segue to the services that are offered by Planned Parenthood, both on the educational side and the clinical side. Although you don't get into the clinical, you know enough about them to give us that information. So what are the educational services that you provide? What does that entail?
Yeah, so the education department develops and implements comprehensive sex education programs. We do a lot of professional trainings as well for schools, colleges, community groups, and organizations. Our list of education topics is quite extensive, but some of our most popular ones are about birth control methods, sexually transmitted infections, healthy relationships, consent and communication. And then one of our big trainings is our Safe Zone training, which teaches people how to be a better ally to the LGBTQ community.
Okay, and that's very important because, as we know, around the country there are lots of folks who are not being treated as well as they should be because of, frankly, a lot of it is ignorance. So, if you can begin to address that, that's great. So talk a little bit about what outreach is. What is it? And you've mentioned a little bit about schools and colleges, but where else can you perform these outreach services?
So outreach is our way of providing agency representation in the community. Our community engagement team attends and hosts a lot of different events. So that way we can connect with the community and inform our priority populations about our services, let them know that we're actually here. Because sometimes people they don't know that we're here, and telling them we are here where we're at gives them the idea that, oh, hey, this is somewhere I can go if I need help. So outreach itself can look a lot of different ways. It can be as simple as we go to the farmer's market one day and just set up a table and meet with community members. We host our own events ourselves. 2 big ones we've done recently. We did a 5K for our sexual assault services program. And then we also did a reproductive rally in Canton and Watertown.
Okay, so it sounds like, like a lot of services in the North Country, Planned Parenthood has been around forever, but it's still invisible to parts of the community, isn't it?
I think so. And a big part of that is definitely a big part of our patient base is the college students. And they come up here and it's just they aren't really aware that we are in this town, especially ones that come from the city. They might not think that this small rural area has a Planned Parenthood.
Yeah, and actually with 7 clinics across the 6-county area, you do serve a lot of colleges, don't you? Because there almost every county has at least a community college, if not a university.
Yes, absolutely. And a big part with our outreach for the colleges is that we provide the dorms with what are called safer sex kits. And those have like condoms and just information about Planned Parenthood. And we provide those to the colleges on our affiliate. And most of the time, it's more than like 1,000 kits that we will make and give out to all these colleges for free.
And that's every year.
Yes.
Wow. So
Yeah.
that is a big part of your outreach for sure. So you mentioned a little bit about some different things that you're doing. Talk a little bit about some of your recent and your current projects that help you to get out into the community, like upcoming events and whatever.
So recently, something we did was planning and hosting trivia in Watertown. We did that at Garland City Beer Works, and that was a great opportunity for us to interact with community members. We also were able to raise donations for our affiliate while we were doing that. And it was also just a lot of fun to interact with the community that way. We're hoping to do trivia there monthly. So if any viewers want to keep an eye out and join us, they're more than welcome. But right now, our big projects include planning and recruiting participants for Day of Action. And then we're also planning for Get Yourself Tested Month in April. And that's a national effort to promote STD testing.
Okay. And I know in the past you've done things like polar plunges to raise funds and things like that. This would have been a great year for that. It's been so cold.
Yeah.
So one of the things that has had to affect your operation, as it has everyone's operation, particularly in the healthcare, has been the COVID pandemic in the last couple of years. I'm sure that has affected the work you do in outreach. So, and you've probably had to get pretty creative, haven't you, in order to continue to do your work and yet still observe the health restrictions that we've been under.
Yes, definitely. So COVID did impact the work we were able to do in terms of outreach and education. Education was moving to Zoom meetings a lot and just meeting with the students on their Chromebooks and talking to them that way. Outreach, we're really lucky with that. Planned Parenthood itself developed a few apps that we're able to use ourselves and talk about with our patients and community members we meet during outreach. A few apps we have are Rue, Spot On, and PP Direct. So a little bit about each of those is that Rue is a chat bot that youth can use if they have some questions they might not want to ask out loud. They're still getting a reliable answer from Planned Parenthood. Spot On is a fertility period tracking app that also tracks birth control. And then PP Direct is an app that really took off with the practice of social distancing. And on that app, users can select between birth control services and UTI treatment. They can receive treatment without a trip to the doctor. And speaking on behalf of our affiliate, in addition to those apps, we do have that option where people can book appointments online with their local health center. Just a heads up way, maybe they don't want to do a walk-in, they want to guarantee that they can be seen, they can book those appointments online. And then depending on the service, we do have telehealth appointments where you can meet with a provider virtually.
So you've really been able to take advantage of a lot of the technology that all of us have been using the last couple of years, simply because going into a hospital setting or doctor's office is not always felt as safe as it used to because of COVID. So that's great that you've been able to leverage that. And I suspect with particularly with your college age clientele, that is a seamless process for them because they're used to doing that, and they are digital natives, as we call them.
Mm-hmm. Absolutely.
So let's move a little bit to the clinical services that Planned Parenthood clinics offer, which is a wide variety of services. It includes contraceptive care, testing and treatment for sexually transmitted diseases, HIV testing, cancer screenings. These are all really critical healthcare services, aren't they?
I definitely think so myself, but we're grateful that we can provide such critical services for our North Country residents. In addition to the services you mentioned, we have pregnancy testing and options counseling. Most people don't know that we also offer primary care services. So we can provide physical exams that might be required by work or schools. We do flu vaccinations every year. And then there are a whole bunch of other primary care services we offer. So if somebody's interested in that, they can go to our website and look. In addition to that, we also offer gender affirming hormone therapy for transgender clients. So if someone's over the age of 18, they can come to Planned Parenthood for their hormone therapy.
And those are important healthcare services because that particular population often doesn't have a provider in the community who is knowledgeable enough to provide good healthcare for folks who are in a transition, do they?
Yeah, I definitely agree. I think it's nice for people to come up here and know that what they might not expect in the community is actually there, and that they have that resource, especially if it's a college student where that they get to go home only a couple times a year. They have Planned Parenthood right in their community where they can go and get that treatment instead.
Yeah, most rural areas, certainly our part of New York State is very rural. There are often too few healthcare providers for the population, and transportation is always a huge barrier for folks, particularly if they don't happen to live in one of the larger communities. Where exactly are your centers located, in which communities, and how does what you do help meet the healthcare needs of the North Country?
So we are really lucky in that we have numerous health centers within a few hours. Our health centers are located in Canton, Ogdensburg, Watertown, Lowville, Malone, Saranac Lake, and Plattsburgh. And I would say that we help meet the needs of the North Country by providing quality care and support to our patients. A big trend in patients that we've noticed is the increase in patients seeking infection treatment. So maybe they're experiencing immediate discomfort with something like a UTI or yeast infection. And you mentioned the too few healthcare providers. They might call their primary care or their OBGYN and be told that they can't be seen within the next few days because their schedules are already packed. And somebody with that immediate discomfort needs immediate help. And so they have realized that they can call Planned Parenthood, and that's a reliable option. And that those clients have turned to us for near immediate help.
Well, like a lot of rural areas, particularly rural hospitals, we've seen closures around the country. And we've also seen even hospitals that stay open, they may close their obstetric units. So that really has to impact the care that patients are looking for. And obviously, driving a long distance for those kind of appointments is tough to start with.
Definitely. I think so. And so, I mean, it's really great that we have so many clinics within a short amount of time, no matter kind of where you're at.
Right. So one of the facets of Planned Parenthood that is almost talking about you being invisible in the community to begin with, but one of the facets of Planned Parenthood that is really invisible to most people is the healthcare services you can provide to men. Let's talk about that and share some of that information, because that's a population that also needs that kind of care, doesn't it?
Yes. So I agree that it is often overlooked. So I'm really glad you did bring that up. But in terms of our healthcare services provided to men, we always have free condoms available in the clinic and at outreach events. So if you're ever at a county fair or at the farmer's market, chances are that outreach staff does have condoms with them right then and there. We have our primary care services. We have STI testing and treatment. And then we also have PrEP, which is a medication that can be prescribed and used to lower the chance of contracting HIV.
Okay, good. What about cancer screenings? Can you do that as well?
Our cancer screenings, nothing really comes to mind right away for men that we would provide with that, but definitely coming in if they have like an issue where they're noticing something, we do referrals a lot of the time. If it's something we can't necessarily screen ourselves or help out with, we can refer people to other providers who could.
Okay, so good. Another part of that primary care service that you offer. That's great. One thing that I don't think people also understand too much about is how services are paid for. You can actually bill insurances, can't you?
Yes. So, big idea at Planned Parenthood is that we never turn anyone away for an inability to pay. We can bill insurance companies, definitely, if there's a potential client wondering what insurance can be billed, if their insurance can be billed, they can call a health center and ask. We also accept Medicaid and Medicare, and we offer services through New York State's Family Planning Benefit Program. We also accept self-paying patients. So if somebody doesn't have insurance or if they don't want to bill their insurance, we can set up like a sliding fee scale for them and payment plans can be made.
Okay, great. That kind of flexibility is so important to people right now, particularly because So many folks have either lost their jobs or they're underemployed, and maybe the job they have now doesn't have the healthcare benefits that a previous job did before COVID hit. So staying flexible is important for folks when it comes to their healthcare. Like every organization that serves the public, Planned Parenthood has opportunities for people to get involved. Tell us a little bit more about how somebody can help out what you folks do.
Of course. So volunteer opportunities, they do exist across our entire affiliate. Anyone who's interested can reach out to learn more and start the process of registering to become a volunteer. In the past, volunteers have helped us make those condom kits for the colleges. They've gone out into the community and just hung up posters and flyers for us. They've helped with community outreach. They've helped with lobbying. So they might write letters to the editor, or they also might just meet with legislators. Viewers can also support our local Planned Parenthood affiliate through donations, which there is a link to donate on our website. And that money donated there goes back into our affiliate and helps North Country residents directly.
So that's local money, stay local in
Yeah.
that case when they go through your website. And we'll be sure
Yeah.
to put the website up as a link. One of the things that is coming up on March 8th is the Day of Action. You've mentioned that a couple times about the opportunity to lobby legislatures and just really educate legislators about the work you do, because that is so important, especially during this part of the legislative session, which is the budget session. So let's talk a little bit about the Day of Action and how folks might be able to be supporters through that.
Yeah, so Day of Action, it's a chance for reproductive rights advocates to join together and meet with legislators, have our voices heard. I would absolutely love to invite the North Country Matters viewers to sign up and join us. It is being held virtually this year, and we have a goal in our affiliate to get 75 participants on our behalf. So if anyone wants to join, absolutely more than welcome to. If they want to sign up, you can reach out to me or go to our Facebook page for more information.
Okay, great. Thank you. I've done a lot of advocacy work for various organizations at the state level over the years, and it's always rewarding work. Making those one-on-one connections with legislators is really important because they have so many things that are kind of flying at them all the time when they're in Albany, that it's sort of easy to lose sight of some of the specific programs that really make a difference here locally in the district.
Yes.
So as we wrap up, Meghan, tell us a little bit about what you're thinking in terms of if this is your first probably big job post-college. So how rewarding is it for you to be working for an organization like Planned Parenthood?
It is very rewarding. When I entered the field of studying community health, public health, I minored in sexual health as well as women and gender studies. And I have a text on my phone from 2018 with my friend where he asked me what I wanted to do with my degree. And my answer right then and there was, I think I'd like to go and work for Planned Parenthood as an educator and work with people in the community. So I followed through for sure. And it is really rewarding. And there's no question about it that our volunteers and donors, they are a huge part of what makes our organization so successful. So we hope that viewers can find a way to support us that works best for them.
Well, thank you, Meghan. I appreciate you coming in today to talk about this. As I said, Planned Parenthood has been around for a very long time, and it's done tremendous work here in the North Country, filling in a lot of gaps in our healthcare for women and for young people in particular. And as you mentioned, with college students coming up here, they don't have local providers because they're coming from away. So if they have a problem and they need to see somebody, getting in is always difficult for even those of us who are established with local providers. But the fact that you folks fill that gap is really, really important. So thank you for the work you do and for the work all of Planned Parenthood is doing for the North Country.
Thank you.
All right. Well, these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.